will spit up. Silent reflux is just as common and presents without the telltale mess. Don't hesitate to consult your pediatrician if you suspect your baby might have reflux, regardless of whether they exhibit all or none of these symptoms. Early diagnosis and intervention can help ensure your little one receives the appropriate care and feels the best. Now, what could be causing your baby to experience reflux? One possible reason is that they might be consuming their milk too quickly, inadvertently swallowing air in the process. If this rings true, consider nursing on one side at each feeding to avoid forceful letdowns and excessive intake. For bottle feeding, ensure that the hole in the bottle's nipple corresponds to your baby's age, as sizes vary among different brands. A nipple that is too large may lead to larger gulps and trapped air, resulting in reflux. Another factor could be the baby's position during feeding, hindering the settling of milk. When dealing with a baby experiencing reflux, try positioning them so that their head is higher than their belly. This helps the milk flow smoothly, staying down where it belongs. Additionally, regular burping during the feeding process is beneficial in preventing reflux. For bottle-fed babies, aim to burp them every ounce, and for breastfeeding, every 5 minutes for a slower nursing baby or every 2 to 3 minutes for a quicker nurser. Implementing these strategies, including mindful positioning and frequent burping, can often do wonders in slowing down your baby's feeding pace, releasing any trapped air, and minimizing the chances of a significant spit up at the end of the feed. Now, I would like to share something that might offer you a fresh perspective on the amount your baby is spitting up. Typically, when your baby spits up a significant amount or even vomits, the immediate reaction is a mix of concern and worry. Questions about whether they have thrown up everything they ate and if you should feed them more right away start flooding your thoughts. This is also true when administering liquid medication. The unexpected return of the contents can trigger unsettling concerns. As a parent, it is natural to be concerned, but gaining a bit of perspective can be reassuring. Let's take a tablespoon of water as an example. Keep in mind that babies usually consume anywhere between 3 to 8 ounces at each feeding during their first year. If I pour this tablespoon of water down a onesie, you will notice the mess it makes and how it seems like much more than it actually is. So when you glance at your baby's outfit covered in spit up, remember that it may look like they have expelled their entire last meal, but in reality it is often much less. When it comes to feeding your baby, it's best to tune in to cues they are giving. If they seem eager for more milk immediately, offering it is fine. However, if they appear settled, it is perfectly acceptable to wait until they signal hunger again. Occasionally, babies who frequently vomit and show signs of discomfort during feeding, coupled with struggles in weight gain, may be dealing with gastroesophageal reflux disease or GERD. This condition occurs when certain muscle fibers acting like a door between the esophagus and stomach fails to close properly, allowing food to come back. If you suspect GERD, it is advisable to discuss your concern with your baby's pediatrician. Whether it is a GERD or common baby's reflux, there are proactive steps you can take as parent to enhance your baby's comfort and reduce the likelihood of reflux. Simple practices such as frequent burping, keeping them upright for 15 to 20 minutes after eating, and opting for smaller, more frequent feedings can make a significant difference. However, if these measures don't yield the desired result, it is worth considering the gut health of your baby. The gut plays a vital role in overall health, and when it is not functioning optimally, issues like reflux may arise. If common strategies like keeping the babies upright and avoiding overfeeding prove ineffective, the root cause might lie in their gut health. It could be an intolerance to certain elements in your breast milk or formula. In such cases, eliminating common allergens for babies such as dairy, gluten, corn, egg, and soy from your diet or the formula may be worth exploring. One important thing to note that implementing an elimination diet requires a thoughtful approach, ensuring that you replace eliminated feeds with healthy alternatives rather than resorting to junk food. This method can potentially offer relief and in some cases eliminate the reflux your baby is experiencing. I have attached a link in the description to facilitate Elimination Diet by Integrative Health, Department of Family Medicine and Community Health. Another effective method to support your baby's gut health is by introducing probiotics. Probiotics play a crucial role in fortifying the beneficial gut bacteria in the intestines, helping them outnumber the less favorable bacteria. A study published in JAMA Pediatrics indicates that probiotics can significantly reduce common issues such as crying, reflux, and constipation in babies. If you're interested in delving into details, I have provided a link to the article in the description below. Before incorporating a probiotics into your baby's routine, it is essential to consult with your pediatrician. Generally, there should be no hindrance to giving your baby a probiotic even if they are in good health. The one probiotic which we use and I highly recommend is BioGaia Protectis, known for its probiotic strain called Lactobacillus reuteri. This particular strain has been studied and proven to assist babies dealing with reflux, cooling and constipation. If you are interested in trying it and discussing it with your doctor, I have included a link below for you to purchase it from Amazon. Implementing these strategies, including managing milk intake, ensuring there are no reactions to food intolerance, and introducing probiotics can lead to a noticeable improvement in your baby's behavior. You may observe reduced crying, fussiness, and discomfort during feeding, along with less spitting up. Ultimately, you will likely experience a greater sense of peace and confidence. Seek a GP's advice if your baby doesn't improve with at-home remedies. Try burping, smaller feeds, etc. but reflux persists. Time for a checkup. If baby develops new reflux after 6 months of age, reflux usually fades by then, so new instance warrant a doctor's visit. Still experience reflux past 1 year old? Persistent reflux require professional evaluation. If baby is not gaining weight or losing weight, reflux can hinder healthy growth, so seek help if weight issues arise. Seek urgent care if your baby has green yellow vomit or blood in the vomit. Could indicate an infection or other problems. Excessive forceful puking requires immediate attention. If the baby has blood in their stool, never ever ignore blood in stool regardless of their age, especially if the poo is black or dark red. If the baby has a swollen or tender tummy, signs of a more serious issues demanding prompt medical assessment. If the baby has a high fever or feels hot shivery, fever in babies needs swift evaluation, especially with other symptoms. If the baby can't keep fluids down or has persistent diarrhea, dehydration risk necessitate urgent medical care. If the baby cries excessively and inconsolably, unrelenting distress could indicate discomfort needing professional attention. If the baby refuses to feed, loss of appetite, particularly with other symptoms, demands a doctor's visit. Remember, this information is for guidance only. If you have any concerns about your baby's health, always consult a healthcare professional promptly. To all the parents out there, I hope this video provides you with valuable information and boosts your confidence in addressing the unexpected challenges of baby's reflux. Remember, you are doing an incredible job, and amidst the spit-ups, dirty diapers and snuggles with your newborn, the love and bond you share are unparalleled. There is truly nothing like a parent's love, and you are the best one for your baby. If you found the information in this video helpful and think other parents could benefit from it, be sure to give it a thumbs up. This lets YouTube know to share it with fellow parents seeking answers. Thank you for joining me in this video, and I look forward to seeing you in the next one.